get started, I'd like to welcome everybody to this special session of Bowie City City Council meeting on Monday, January at 8:02 p.m. And as we do with all meetings, let us get started with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. At this time, City Clerk, for the record, would you confirm that we have a quorum, please?
Yes, Mayor, we have in council chambers, we have council members Harrison, Wolfley, Esteve, and Gardner. And virtually we have council member Ndebumagu and Mayor Adams. Mayor Pro Tem Boafo will not be able to join us this evening.
Okay. On this note, we'll get started right away just to make sure everyone understands the purpose for this special city council meeting was called was to address we had agreed, I want to say last Monday, on the reopening of facilities within the city with the stipulation that people would show proofs of vaccination and would wear masks. It was asked by Council Member Esteve, and we were voted on to have a special session, and we needed to do that in special session and not just by a council poll, because we had discussed this and agreed to this publicly. So now the question is whether or not we will remove the requirement to show proof of vaccination before entering the ice arena and other facilities. What I have asked is that we do get an update on where we are with the virus at this time, as it is hitting our community very hard. And so I've asked Dr. Truby Hall, Dr. Obi, and Dr. Madan, if they could just give us an update, if they wouldn't mind briefly, to just let us all know. And I see Ms. Janine Richards is on with us too, of where we are right now with the virus at this time. So I don't know who would like to go first. Please feel free. If that's the case, I will, Trudy, you're right in the middle. Or you'll go, Dr. Madan, please go right ahead.
Hi, good evening. Thank you, Mayor Adams, and thank you, council members, for having us here. And thank all the other guests that have come as well. I'm Dr. Sunil Madan, the Chief Medical Officer at Luminous Health Doctors Community Medical Center. As you are probably well aware that many of the institutions within Prince George's County have declared what's called crisis standards of care, which means that the demand is very high and the resources that we have are stretched to be able to provide the services to our community. The infection rate for COVID is at the highest point it's been since the start of the pandemic in the state of Maryland. Specifically hospitalizations, give you an idea, on Thanksgiving Day, we had 8 COVID positive patients that were hospitalized at Doctors Community Medical Center. Today we stand at close to 90. So 11-fold increase in hospitalizations. Within the system of Luminous Health, we have over 230 hospitalized patients today. So a tremendous increase in our hospitalized patients that we're taking care of. Most of the hospitalized patients that we're taking care of are unvaccinated. Approximately 70% of those are hospitalized. The other 30% are vaccinated individuals who have comorbid conditions such as diabetes, blood pressure, obesity, or other medical conditions, which make them high risk and they become hospitalized. The systems within Maryland, the healthcare systems, are definitely overloaded at this time. We are trying our best to meet the demand of our communities and take the best care of our patients with the highest quality. I'll stop and ask if Deneen Richmond, our president, would like to make some comments.
Hi, good evening, everyone. Thank you, Mayor Adams. Thank you, Dr. Madan. And I'll just really briefly, because I know don't want to take too much time, just really, I think Dr. Madan really summarized things very well. At this point, I would just say as that what we are looking for from the healthcare community is just really the need to change the trajectory of the demand for hospital services. So you heard the statistics, I won't repeat those. And we're strained. I think it's fair to say that we are very strained right now with the number of patients, and then as well as dealing with our staff who, you know, at this point are almost 2 years into this pandemic. So our healthcare workers are, I would say it's safe to say, physically and emotionally drained, and our system and our resources are strained.
Thank you. If we could go now, Dr. Trudy.
Yeah, good evening, everyone. Dr. Trudy Hall. I'm the Vice President and Deputy Chief Medical Officer for University of Maryland Capital Region Health. I'm also site exec for Laurel Medical Center and the Laurel 345 alternative care site for the state of Maryland, where we are treating all COVID patients as one of our sites. At this time, there are only 2 alternative care sites, our site in Prince George's County, and then the site that is in Tacoma Park, which services part of our county, but also Montgomery County. I want to echo what my colleague, Dr. Madan, said. We have seen unprecedented times regarding where we are in this pandemic. We have seen more infections of our healthcare providers in our community in 2 weeks than almost in a year and a half of this pandemic. This Omicron variant spreadability is, we can't even describe it. I almost want to think you can blink and you can get this variant. It is straining all of our resources. We are all facing crisis standard of care. Our healthcare providers are getting infected. And this is not just for Prince George's and Montgomery County. This is the entire state, to the point where the governor has actually created a 30-day time frame of emergency for us to be able to provide resources and get extra resources to provide this level of care. Right now, there are over 100 patients at the COVID alternative care site, and in Cap Region alone, there are close to 200 patients that we are treating now with the COVID Omicron variant. Some still may have the Delta variant. Even though there are milder symptoms, because the number of patients that are being infected are so high, we are really struggling with enough resources and hospital beds to care for patients. I know a lot of this has been on the news, but this is close to home. This is happening right here in Prince George's County. So even though some members of the community can have mild symptoms, still there are members of this community that are still getting hospitalized and placed on ventilators, as well as passing away. I know there's an argument that even though you are vaccinated and boosted, that you can still get the Omicron variant. 70% of the patients that are in the hospital right now are non-vaccinated. 5% are vaccinated and boosted. So it is very clear there's a level of protection from being hospitalized, as well as severe disease, as well as death. So again, we're just saying right now after the holidays, the numbers are so high and it's spreading so fast. And we are at a healthcare systems, the main healthcare systems for this county are saying that our resources are so stretched that it is difficult for us to provide care. And now is the time for us to have serious talk about what we can do as a community responsibly to be able to prevent this from spreading further.
Thank you, Dr. Truby. Dr. Obi may have dropped off, I believe. Are you there, Dr. Obi?
Yeah, I'm here, Mayor Adams, and I think I can only echo what my other colleagues on this forum have mentioned. I think there's some misunderstanding about, maybe I say two things. One is how severe the cases with Omicron can be. I don't think we quite know. I think there's in the media, everyone is saying they're just mild cases, but they're not mild if you're infected and you have to be hospitalized. So, from the perspective of, the medical community, I think we have to take it seriously. We have to curb the spread of it. I mean, it's far more infectious, than the original, COVID-19, as well as the Delta variant. In fact, we're seeing, more cases in children as well. And I think one of the things that we're here to discuss in terms of recreational facilities, which are high-risk facilities. I mean, where kids and adults can congregate. I think we have to take it very seriously. And I think as this surge continues and the hospitals continue to be overburdened and healthcare providers, continue to be at higher risk, in our population, we're going to have to do our part and act responsibly. I think it's a very small sacrifice, to make these, judgments, and these regulations for everyone in the community. I think there are going to be naysayers who think that either they've gotten COVID before, and because of that, they have immunity, or they had COVID and it wasn't so severe. But when you talk about the number of people who've died in the state of Maryland, over 12,000, the number of people who are infected and who are suffering, the sequela from the infection, they don't take it lightly at all. They understand it. And I don't think it's reasonable to have to get to that extreme to understand what we're dealing with. We've been dealing with it for the last 2 years. So I think, this is a very important question. It's a question about, how we protect, members of our own community, and how we act responsibly in this time.
Okay, thank you, Dr. Obi. I would just now open it up. Are there any questions from any of the council members or any of our medical experts? I hear none. Dr. Trudy, or one of you, can you just share with us whether it's fact or fiction that we are having more kids become hospitalized for the Omicron variant than before?
It is fact. We are running the numbers every day. And again, we're actually counting the number of beds that we have for children. So again, I know it's been difficult. We're so happy that now that children can get vaccinated. But right now, I looked at the data, ages of 5 to 9, only 23% have been vaccinated, and from 10 to 19, 62%. So we're still needing to get those numbers to be elevated for us to protect our children, and to try to prevent them from getting infections. Where it ends up being a bigger issue is when the children infect the adults. So they may get infected, but they may bring it home to mom or dad or grandma or grandpa, and they may, have a more severe infection and can get hospitalized. So again, increase in children, the numbers have gone up, and then again, just to risk the children getting infected, what does it mean to the family unit?
Okay, thank you, Doctor. I don't hear any questions from any of the council members. So I guess that just leads us to move forward at this time.
Yeah, Mr. Mayor, if I could just chime in real quick.
Yes, please, go ahead, Councilman.
Thanks, Mr. Mayor. First of all, I appreciate everyone's participation tonight, and as well as our guests. We all recognize after 22 months that this pandemic's a real thing. We recognize that it's serious. I have been twice vaccinated, boosted. All of my colleagues have. Bowie is one of the very few communities in the state with 100% vaccination compliance right now among its employees, which was no small feat. We have erred on the side of caution for 22 months. We continue to encourage everyone to get vaccinated. If you have any questions about vaccinations, we strongly encourage you to talk to your general practitioners. If you have questions about vaccinations for children, we encourage you to talk to their providers, their pediatricians. All that being said, right now, in the state of Maryland and in Prince George's County, the vast majority of physical buildings where people go are open, and their only rule is to wear masks at this time. I see no reason going forward why we shouldn't abide by the same. We recognize the seriousness of the pandemic, but we also recognize that there is a cost of keeping people at home, of keeping facilities closed, and of keeping people from doing those normal human interactions, which are all important. That being said, I would like to make a motion that starting tomorrow morning, Bowie, the Bowie City Gym, the Bowie City Ice Arena, and Bowie City Historic Properties impose only those rules as required by the county, namely the mask requirement. I ask that that be enforced, and I ask that we drop any other requirements.
Second.
I'd like to,
Who second that?
Second.
And staff, I just want to be sure, is that clear? Does that cover what you need to know instruction-wise?
yes, we understand that. Thank you.
Perfect. Thank you.
And who was the second? I couldn't.
Ingrid Harrison was the second.
Okay. And let's open it up for discussion at this time. I think I will lead off with that. And the one thing I do want everyone to understand is that Park and Planning and the county has closed all recreational facilities. They are not open. They are not letting people in. So as we move forward, I do want to make sure that everybody understands that the county has closed all of the recreational facilities, and that I still believe it's a challenge. I understand, particularly the ice hockey, people who have competed and they want to go through their playoffs and they want to do all those things, and the nature of being socially active and all of those things. I really do. I understand that. But I don't think now is the time to do that. And if they could, I would have said to them, please just postpone it for a while longer. Ice hockey, for example, is a contact sport. And again, it's not just those coming in, but it's also the city staff. And as we've heard, the people who end up having to deal with that being our healthcare professionals, and the strain that it's already on our system. So I say again, my position is I understand the need and people wanting to play and be together, but I just do not agree that at this time that we should be opening up facilities when the rest of the entire county has closed all of the recreational facilities, that we should be opening them up. So having heard that, I'd open up for discussion to anybody else on the council.
Mr. Mayor,
Yes, please go right ahead.
I just have a quick question for council members, staff, during the discussion phase. I would like to ask if my colleagues would consider an amendment to that that motion. Oh, sorry, hold on, I can turn my camera on. Would consider an amendment to that motion. I think mainly because as the county has closed all recreational facilities in the Prince George's County, and health advisors are recommending something different, would my colleagues be willing to consider possibly the ability to be vaccinated or provide a negative COVID test to leverage our facilities? Would they be open to considering that?
Thank you, Councilmember Ndibu Madu.
Yes.
Since I made the motion. So right now our goal is to simply bring our policies in line with those of 99% of the open buildings in the county and in the state right now. So going to a restaurant, going anywhere for the most part, there are no additional requirements apart from mask wearing, and our goal, I think, is simply to bring our policies in line with that at this time.
And also, I'd like to make a comment. Our General Assembly will be going into session on Wednesday, and the governor has yet to close the Senate and the House. I don't know of any other facilities that have been closed outside of what's in Prince George's County. So just making note of that.
Thank you, Councilwoman Harrison. I think that's a really great point. And thank you, my council member Steb, for answering that. But I think given that the county has closed some of the parks and recreational facilities, would we be open to considering that? Because I hear your point on the restaurants and the businesses and all that other stuff, but I'm not sure that it answers the question on the facilities that the county has closed for the next 7 days. So would you be willing to consider that, or is that a no?
Yeah, so I appreciate the question, Councilmember Ndibumadu. Right now, as far as I know, Prince George's County Public School students are going back into their buildings starting on Monday. The vast majority of county facilities are currently open with only mask rules in effect. When folks had to come into City Hall tonight, they didn't have to prove vaccination status or get a negative COVID test, and that's the case in all county facilities as well. But for the small number that happen to be under the jurisdiction of the Prince George's County side of Maryland National Capital Park and Planning. So it's a very narrow subset of facilities that the county has closed. I don't fully understand the rationale, given that all other buildings, like I said, 99% of buildings right now that invite people in only have mask rules. And so I think our desire is simply to be in line with those policies.
If I may.
I was going to say, Mr. Mayor, if I could just say one more thing before you go ahead.
Yes, go ahead.
Yeah, I understand what you're saying, but I think that we're picking what logic we choose to appeal to, which I'm not sure that it fully makes sense, because if there are parks and recreational facilities that are closed due to the surge of this new variant, and we are basically saying that we want to bring that in line, then essentially us bringing it in line would be closing our facilities. Now, I'm not saying that I'm advocating for that or that I would vote for that or I recommend that, but I think that would be that logic. And so I think if we look at the facilities that the county has closed, since there are certain parks and recreational facilities that Prince George's County has closed, I don't think we can say that we're trying to bring it in line with that, because that's not exactly what we're doing. I think what we're doing is essentially voting to remove the policy that we have in place, because there are a certain number of residents that disagree with that policy, which makes complete sense if that's what we're doing. But I just kind of want to call that out, because I think if the county has closed certain facilities and our health regulators are recommending that we move in a certain direction, that we consider all of those alternatives. And that's why I asked if we'd be open to, if not just a vaccination, and just providing a negative COVID test, mirroring those recreational facilities, not necessarily speaking on the rest of city services. But I'll pass it over to you, Mr. Mayor. Thank you.
And council member, if I could just reply quickly, I understand completely what you're saying. My point is simply that right now in Prince George's County, private gyms, restaurants, schools, most public facilities are all open and only enforce mask rules at the moment. And so what I'm saying is we just simply want to have policies that are consistent with what's going on in the overwhelming majority of public venues in the county. That's more my point, but I understand your perspective. With that, I would respectively call the question.
I'm going to make a comment. First, I haven't, with a little further discussion, and that being what we have to understand is, though those facilities are open in the county, they're mask wearing, and it's still required that there be social distancing. I cannot imagine how anybody can social distance by playing ice hockey. That goes against common logic. I'm sorry. And so understanding that, and understanding that with recreational activities, I think what the county saw and what I've heard back from them is that people come in close contact with each other. And that's the concern. It's a lot different in wearing a mask and being social distance than bumping into each other while playing hockey or any other recreational activity, including basketball, that doesn't require social distancing. So having said that, I believe you asked for us to call for the question.
Yes,
And
Mr. Mayor.
we would like a roll call vote, please. City Clerk?
Okay. Mayor Adams?
And I'd like my answer to be part of the record, that I don't believe this is the most responsible thing to do at this time, where the county has closed all of the recreational facilities and that we are opening them up without the ability to social distance. And I would say strongly that this will put a further stress on our healthcare providers, and it will not protect, and I think it's a little hard on our city staff. I do want to say I understand the need and the willingness, because the young people who have played ice hiking and other sports who want to get on with their championships and other things, I understand that. And I believe that they really want to do this. But I don't think it's in the best interests of the citizens or our city staff to proceed with this. So I vote no.
Councilmember Gardner?
Yes, City Clerk, I want to say before I cast my vote, and I'm going to be very brief, it is my opinion, with the government asking or encouraging individuals to become fully vaccinated, then to take a booster and to sit at home while we close everything is totally unfair. Then to enforce a vaccine to those who choose not to be vaccinated for whatever reason is unfair. But if we can ask individuals to walk into our facilities, be it a public restaurant, or grocery store, a gymnasium, and they're wearing a mask, then that is adequate. And if individuals who are fully vaccinated and feel that they are unsafe because of COVID, they do have the option, and I do mean this politely, to stay at home and not participate. COVID is a disease that is going to be around with us for quite some time. This is the third January that we are dealing with it. I had COVID. It was a very, very difficult situation for me. I personally lost 7 family members that have died from COVID. But again, we cannot stop living. Life is for the living. We have to open up. We have to continue on with life. For those who are who feel unsafe, they always have the option of staying at home, not participating in recreational activities, not skating, not doing any of the activities that may expose them to COVID. They have that option. And I know that we have very intelligent human beings, not just in Bowie, but across our fine nation. And so everyone has the option of choice. And if we're mandating things, then that's not fair. So I'm voting yes to open facilities. I support Councilmember Esteves' motion fully, 100%. Thank you, Mr. Mayor.
Just for a point of clarification to proceed, when it's a roll call vote, it's not open for discussion, it's just straight for the vote. So please try to remember that.
Okay, thank you. Thank you, City Clerk. Thank you very much.
Councilmember Harrison?
I just want to say that the mayor gave quite a diatribe before he voted, so I think it's only fair that Councilmember Gardner can say what he wanted to say. But my vote is aye.
Councilmember Esteves?
Aye.
Councilmember Wolfley?
Aye.
Councilmember Ndebumadu? Councilmember Ndebumadu?
I'm here. Hold on a second. Yeah, so I agree with Councilwoman Harrison. I'm going to go with nay, but I am going to share that the only reason why I'm going with nay is because I do think there are other things that we could be doing, not necessarily requiring a vaccine, because I'm not for requiring people to get vaccinated if that is their personal decision not to, but I do think there are other steps that we could be taking to make sure that other members of the community are safe from those who seek to be negligent in times of COVID. So I'm going to go with nay.
Thank you. Mayor, the vote is 4 ayes, 2 noes.
Okay, thank you. The motion carries. I'd like to thank our guests for coming this evening. We appreciate all you're doing in our community to try and keep us safe, and we appreciate all that those on your staffs are doing.
Mr. Mayor, I'd like to move to adjourn.
Excuse me?
I'd like to move to adjourn.
Second.
As I was saying, I'd like to thank our guests for being here this evening, and we appreciate all that you've done. And I'd like to thank our citizens, for those who tuned in, for participating, and I hope that everyone remains safe. At this time, I've heard a call for adjournment, and it's been seconded. Any discussion? Hearing none, call for the vote. All in favor, respond with an aye.
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 Opposed, same favor. Motion carries. We're adjourned. Hey, thank you again to everyone who tuned in, and please have a good evening, and please stay safe. Have a good night.